Rick Goodwin. Known for quite a long time now. He's been a committed supporter of men for at least 20 years. And his talk tonight is truth-telling, the case statement for male-centered therapy. Rick was the executive director of the Men's Project in Ottawa for quite a number of years, and he's an expert in helping men to heal from sexual trauma and other forms of trauma. So, welcome, Rick.
Thank you, David. Hey. So we may be small, but that doesn't mean we're not mighty. So welcome you all in coming out tonight. We had a couple minute shuffles. had a PowerPoint, blah blah blah. But we're going to move this to an informal discussion group. Though I'll be using my my cheat notes to cue me on an agenda. I want to say a couple words, but then I'm really more interested in that we all participate in some sort of kind of warm up, getting to know each other thing. But David's right. I've the Men's Project, which has been a charity in town providing counseling services for men, has recently, well, I should say, as of next Friday, will be closing its doors in terms of counseling resources in the community after 18 years. And this had to do with the funding, loss of provincial funding, essentially, and uncertain direction as to what the organization is doing. That has left me and the clinical staff, of which there are 4 or 5 others, wondering what to do, especially with what to do with these dozens of guys who are currently having care. And so towards that end, we're setting up a modified practice called Men in Healing. That will start up November 1st. Just signed the lease. It's over on Beechwood Avenue. And we'll continue to provide this service for men in the community, albeit in a different form. It will not be a charity, and we will not be dependent on government money. And whether it's going to work, whether it's not going to work, who knows? It's hard to predict the future and such things. But the momentum is there, and the commitment that the fellow therapists and I have to serving men who are currently in treatment, that will continue. So wish us well in that regard.
Absolutely.
I'll be speaking on that near 20-year experience of providing counseling therapy for men. Just to say a couple other things that I'm up to now. I work part-time for an American outfit called 1 in 6 Inc. That is the stat on male sexual trauma by age 18 for guys. And if you want to know more about that, we can talk about that more. So I'm doing some work there in the States, doing training for service providers, particularly in the U.S. Military. So this is a real new chapter in the evolution of these services. It seems kind of funny that the U.S. Army is in some ways taking a bit of a lead in institutional response to this issue, when we may not see that lead elsewhere and up here, down in the States. So I do that work as well, happy to reflect on that. But the topic here is really a male-centered lens to doing therapy. You may say, well, why male-centered lens? Why not, a humanist lens? And just to give a bit of background on this, I think we're all aware that the feminist movement, or the second wave of feminism in the 70s, 80s, provided not only a social shift for the understanding women's situation in society, but also provided a basis for engagement, for counseling, for therapy, for psychology. It was like that wave of feminism was saying, all those textbooks, and if any of you have taken any courses in psychology, you know what I'm talking about. Those dusty textbooks, with Freud and Piaget and Maslow and Kohlberg, all these theorists who happen to be male don't speak to women's reality, don't speak to women's experience. So hence a recreation of psychology and therapy to engage with women. The new psychology of masculinity, which we're kind of being part of, is a similar wave of rethinking therapy. It may have started, I would kind of say in the early 90s, it started up in a robust way. And we're part of that thinking, which is, you know, the Freud and Piaget and the Maslow and the Kohlberg and all those kind of thinkers or theorists around psychology, they didn't really speak to men's reality either. And that's maybe a harder sell to do because they're all guys who wrote that work. It's a little bit more subtle analysis. But I think as we'll get into the conversation tonight, there is a way of looking at men's reality that can provide the fodder for change, personal change, which is what therapy is. And I'll be focusing a lot tonight on issues of sexual trauma and using that lens.
Question protocol, do you want? Questions as you go? Or?
Yeah, certainly, certainly. But I'd like to get through having Sol do the introductions before we kind of get to that. So I'm still in my opening remarks. How's that? So yeah, we could be gathered tonight to look at domestic violence and using a male-centered lens. We could be looking at addiction using a male-centered lens. That area of psychology is small, but it's getting robust in the sense that we can now look at things in a gendered lens, not necessarily a female-centered lens, but a male-centered lens, and hopefully get better therapy, better change out of the process.